Heard on Thursdays with Nikki is about to go live online. Catch HOT, the iconic radio show that made Philippine FM radio talk, every Thursday on the Monster. Streaming video on the Monster Facebook page at RX931, the Monster YouTube channel at RX931, and twitch.tv/Monster RX931. You heard on Thursday's host, Nikki Porter. Stand by and enjoy the program.
Good evening, Monsters, and welcome to the show that made Philippine FM radio talk heard on Thursdays on the Monster. I'm your host, Nikki Porter. Now, there's a reason why skincare is a $200+ billion industry globally. Anywhere you go, there's an ad for a product that promises healthy, beautiful skin. When you go on social media, you see your favorite celebs and influencers sharing their skincare routine. And as early as our tween years, older family members often impart skincare tips. But oftentimes, when we are not genetically blessed with flawless skin, it gets a little confusing. So when it comes to taking care of our skin, is it really necessary to do a 10-step night routine? Is it better to keep it simple? Do we really need to use a moisturizer daily? Is SPF enough, or is it too much? So at the end of the day, we all just want our skin to be at our healthiest. So tonight on HOT, why don't we ask all our skin-related questions to someone who can actually give us legit dermatological advice? Tonight we have Dr. Bea Chan with us, a full-time dermatologist, fur mom, and content creator. She's a firm believer that less is indeed more, so she always gives out easy 2 to 3 step skincare routines for her patients. She graduated magna cum laude from UST College of Pharmacy and got her medical degree from St. Luke's College of Medicine. She then finished derma residency training from the Jose R. Reyes Memorial Medical Center, Department of Dermatology, Most Outstanding Resident 2020, and Top 7 PDS Diplomate Exam 2021. Heard on Thursdays, let's welcome to the show Dr. Bea Chan. Hey!
Hello! Hi, Nikki!
Oh my gosh!
Hello, everyone!
Welcome to the show. And so for all the monsters who are listening either on radio or watching live on YouTube, Twitch, Facebook, and also on TikTok now, you might, just for some context, we are barefaced right now. Maybe Doc Bea has a better complexion than me, but I'm just letting you guys know we're doing a barefaced interview right now because we will be doing a skincare routine with you guys later on, okay? So we'll wait for that, but for now, thank you so much for joining me this evening, Bea. So first of all, when I read Fur Mom, do tell, what is your pet? What is your child?
Yeah. So I have 2 kittens. One is actually 7 years old now.
Wow.
Yeah, he's kind of old now.
Oh, he! Oh
yeah,
my gosh,
and
so
then he's a mama's boy. Talagang pinento na. Yeah, and then I just adopted him actually. I literally just pick him off the streets.
Wow.
Yeah,
oh my gosh, I
and
love
then
that.
my second one is a girl. She's Katie. And then siya naman medyo siya, daddy's girl naman siya.
Oh, I see. Okay.
So that's our family.
All right. I love that. So cat mom or cat parent. And now we're actually going to head into dermatology. For our monsters who are probably thinking about heading into dermatology, maybe you're a med student or a pharma student, if does that make sense?
Yes, actually it's pre-medicine.
Oh, pre-med, who are in a pre-med course also. In terms of dermatology though, was that something that you always wanted to study while you were growing up, or did you have a different path in mind?
No, well, I think in general, for most Filipino families, if you think about like doctors, you have like one specialty in mind. Basically, it's those studying internal medicine.
Yeah.
So that encompasses your cardiologist, pulmonologist, you know, and then sometimes I even get a question like, are you even like a doctor. So
wow.
there's this misconception about it. So basically, beyond the internal medicine, we also have a lot of different fields like dermatology.
I see. And so, do you mind sharing with us, for those who are interested in pursuing dermatology, like I mentioned also, how many years does it take for you to be board certified? Is it like a fellowship that happens? So
Oh.
how does it go?
Yeah, so let's start with the pre-medicine course. So basically, it's your usual college degree. So it's 4
Okay.
years. Usually it's 4 years unless like you're a physical therapist, it's 5 years. And then after that, you go into medicine. So that's approximately 4 years. And then 1 year as internship, for internship. And then, so that's 9 years na.
Yeah. Oh my gosh.
Yeah, and then they'll be guessing my age na.
No naman. No naman.
Yeah, and then after that, basically, you can go into residency. So that's dermatology. So that's another 3 years. So it takes approximately 12 to 14 years because, of course, in between, you also have to pass board exams. And you don't usually take them like at the end of the year. It's usually somewhere like mid-year, sometimes September or June. So yeah, so there's like a 6 months gap.
I see. Okay, well, so it's a long process and a long journey, as with a lot of like medical fields that people would want to pursue. So if you guys are interested in it, you can also like DM Doc Bea probably if you want to find out more about how it works. Now, is there anything you'd also like to share for these potential students on what they should expect when they enter, or they want to pursue dermatology? Like, are there any common misconceptions that they should be aware of, or the environment itself? What is the scope of skin? You know what I mean?
Yeah. So basically, dermatology is one of the most sought after training programs because honestly, it's benign. We get like 48-hour shifts when you were like medical students. So basically, you wanted something like you wanted to have like that work-life balance.
Yeah.
So basically, some training programs would give you that. So one of those would be dermatology. Now, there are limited slots per institution, and currently there are still few accredited institutions that actually provides this training program. So, well, you have to have good grades.
Okay.
And then, of course, you also have to deliver, because the training program, basically we have this pre-res period. So this is the pre-residency part, and then it's just like 3 days to a week. So you have to like stand out. You get what I mean?
Yeah.
It could be a good thing because you have more chances of like, if you don't get accepted, you can try out on another institution. But then again, like, it's really hard to make a long-lasting or a good impression in just a few days' time.
Right. Yeah.
Right? So I don't know. Maybe it's kind of hard work, luck, and then of course good grades. I would say.
So then if you could share maybe some tips, because you said it would only take a few days to make a good impression. What did you do? Or like, no, I'm just kidding. What would it take to make it seem like you stand out or you're worth a shot?
Oh, well, it's basically trying to learn everything that the residents will feed you on those 3 days.
Which I'm assuming is a lot.
Yeah, so basically you just try to absorb everything that you can. And then it will feel like, it's everything's... Honestly, when you see a rash, how would you describe it? You'll be like, oh, Doctora, I have a red rash. But that in derma, we have patches, plaques.
Oh, right.
So like,
different terms.
macules, papules, and you'll be like, oh no. Yeah, so it's basically trying to absorb everything. And then of course, it also always helps to be, not that competitive because it's kind of, off-putting as well. Like, you don't want to be that person that, tries to pull others down just so that you can like shine.
Right.
Yeah, it's very apparent as well.
So I'm sure it would also be helpful to, I guess, continue to do your readings, like with regard to like all the derma terms that you need to know.
Yeah, and then well, basically most institutions would really just look for potential because
I
like
see.
all of you will be just on the same level.
Yeah.
But then I don't know. Maybe it's the personality. Maybe
Yeah.
you're funny. We also have interviews like this, pala.
Oh, really?
Yeah, and then sometimes they ask you to, can you dance or can you sing?
Oh, like unrelated.
Yeah, and then you have to like show your skills.
Talent show.
Yeah, because
Wow.
otherwise, parang if you say like I don't have any talent, they'll think na you'll be not like well-rounded.
Okay,
Yeah.
got you. All right. Well, so there, for those monsters who are interested in pursuing dermatology and in wanting to stand out, then I hope these tips have helped you so that you know how you can pursue it and also excel at it. Now, like I mentioned earlier, Doc Bea and I don't have any makeup on right now. So we are going to be doing a PM, or an evening skincare routine. It almost feels like we're about to go to bed, but not really. So stay with us. We are going to show you the different steps. Her steps are different from mine, so we'll just follow each other on whichever step the other is. So we'll talk application, sequencing, how to apply these products also. And if you have any questions, go ahead and comment on our socials or in the live video on Facebook, on Twitch, or on YouTube, or even on TikTok. And so we'll try and address it as well. So let's get to it.
Let's start. So basically, we've already done our double cleansing. Well, me, at least. So what double cleansing actually as a concept that came from Korea. So you usually use like an oil-based cleanser. It could be a cleansing oil or a cleansing balm that, you know, removes all the dirt, pollution, oil, and makeup on your faces. And then it's immediately followed by your traditional water-based cleanser.
I see.
Yeah, but just to clarify, not everyone needs to double cleanse. Like you, Nikki. You didn't, right? So basically, those who wear or who uses mineral-based sunscreen. So those are sunscreens that contain zinc oxide and titanium dioxide, as well as, of course, if you wear makeup, of course, and water-resistant sunscreens.
Okay, so we did our cleansing. I did not double cleanse, but also for those who are interested in double cleansing, might want to consider it if you are. If you wear heavy makeup, and what else was
and
it?
then sunscreens, mineral sunscreens or water-resistant sunscreens.
Okay. All right. So what is the main purpose of like a facial cleanser? So let's get a little bit like more educational in terms of the different products. So at least people know what they're putting on their face as well. So facial cleanser, I guess by the name itself, it cleanses your face. But you said there are two. There's like an oil-based and a water-based.
Yes.
So what is the difference between the two, apart from those two, being oil and water-based?
Yeah, so basically, nowadays we have been using more waterproof makeup. So
right.
basically, your water-based cleansers won't work on them.
Yeah.
Right? So, kanina, I was making Nikki budol na.
I will do
I was
it.
telling her na you should really try this cleansing balm. Because actually, there are times when you attend events and then you're so tired and stressed and you want to sleep with your makeup on. But you know, with these products, basically you can remove your makeup in one try. Honestly, yeah. So
Wait, without like a cleansing wipe, like a makeup remover?
well, what you do is you try to emulsify it onto your palms. So
Okay.
you take a few, how do you say, a scoop, I guess, and then you emulsify it onto your palm and then rub it slowly onto your face. A gentle massage here and there. It's getting a bit relaxing, okay? Yeah,
Massage it.
Yeah, massage here and there, and then wait for your makeup to dissolve. You can see it, of course, your eyeliner's getting all smudgy.
Smudgy, yeah.
And then your eyeshadow is, all over your face. I don't know. And then you rinse it off. And then it usually leaves like a milky white residue on your face. So you have to use your water-based cleanser immediately afterwards.
Okay.
Yeah, so the advantage would be, of course, the makeup, the dirt, the pollution won't clog your pores and it won't lead to breakouts.
Okay. So the cleansing balm, though, can you use that on its own without the water base, or they have to be paired up?
Yeah,
Okay.
actually you have to pair it up. Because I'm not sure if you guys have tried it, but when you use it on its own, well, it doesn't leave your skin oily naman, but it's not clean.
It doesn't feel
Yeah,
like
it doesn't
yeah.
feel like clean. How do I describe it?
Yeah, I get what you mean.
Yeah, so basically you have to use it with water-based cleanser. And nowadays, the water-based cleansers are actually more on the acidic part because our skin is naturally acidic. And then they found that the pH, wherein it's an ideal pH level, would be your pH 5.5.
Okay.
So if you use pH 5.5 cleansers, it's supposed to maintain your skin on its healthiest state.
I see. Okay. So we should be using cleansing balms and the water-based cleanser to get one after the other, immediately after the other. And so now, what comes after the facial cleanser?
Yeah, so now we're on the controversial part. What?
Oh yeah.
Controversial?
Okay, so I love. Okay,
Yeah,
this is a good
so
part.
yeah, we can do it now. Yeah.
All right, we're demonstrating right now. Let's go.
So basically, I'm using this calendula toner, and what I've been telling her is my favorite part about this toner is that the scent actually motivates me to finish my whole nighttime skincare routine.
I love that.
If it makes sense, okay? If you guys get me, it just makes me happy and less stress, I guess.
That's good. At least it has that, effect on you. Kind of like lavender, but like, I guess, calendula in this
so
sense.
I'll be starting my application. So
Okay.
what I usually do is I apply it directly onto my palms, but you can also use like a cotton pad.
Oh, okay. So you don't have to use a cotton bud.
Because there are some that would say that most of the product would just be absorbed by the cotton pad and then less on your face. So parang it's sayang.
Yeah, okay.
So if you want to maximize the use, of course you have to have clean palms. We sprayed alcohol na.
Yeah.
Go.
Oh, I should spray it now. But go
Yeah,
ahead.
and then so you just apply it like a few onto your palms, and then like rub it in, and then just dab it onto your face.
Dab it on your face. Okay, I'm using an alcohol-free toner. So it's budget-friendly. It works for me. It works for me. So, okay, a few dabs.
Yeah, but mine as well. Actually, it's also alcohol-free. But just to clarify, alcohol-based toners are not really bad, okay? Because they might have that misconception because both our toners are alcohol-free. So basically, alcohol-based toners are more for those with oily skin.
Right.
But they can be a bit irritating for those with dry and sensitive skin. So the main function of alcohol-based toners is to remove the excess oil. Diba? Kasi if you have oily skin, you need that, extra push.
So it looks like a little matte.
Yeah.
Yeah. Okay, gotcha.
Okay.
And then so you mentioned this part that was controversial. So she told me, or Doc Bea told me off air that you don't necessarily have to use toners at night. So please tell us why that is.
Kasi I made kwento na a while ago, yeah. So basically, toners are really not an essential step nowadays because its main function is to restore the natural pH level of your skin back to the acidic level. But then again, like what I've mentioned a while ago, most cleansers nowadays have been formulated to be acidic. So it's compatible with the skin's natural pH. So now, the question is, do you still need toners? Honestly, in my line of practice, if the patient has limited budget, it's really like, you can do away with the toners now. But then me, I still use my toner for the reasons stated a while ago. Yeah.
Okay. And so after dabbing the toner, we don't need to wipe it off. Like, just leave it.
Yeah.
Really?
Yeah. And
Wow.
then it gets absorbed quickly onto your skin. naman.
The reason why I asked it is I always had that impression where, kasi niba, it's on the cotton pad and then you just
Yeah.
like swipe, and then you see like, maybe some residue or
Yeah,
something.
yeah.
So to not wipe, I feel like that gives me a little bit of anxiety now because it's like, what happens to the dirt if I don't swipe it?
Yeah, but basically what you have to remember is that the function of toners primarily is not to remove like residual dirt or makeup.
Okay.
So maybe the key is to double cleanse.
All right. Okay. She is really plugging the double cleansing. All right.
Yeah.
I am about to buy into it as well. Okay.
Yeah.
So the toner will prep us for the next steps as well. Now, following a toner, since both of us have applied toner, is this where we start to apply like the essences, the serums, when we put face masks also?
Yeah, so sometimes you can also use essences, but I don't have any essences as of the moment. So the primary function of your essences is to hydrate the skin from within. Yeah, so Korean beauty standards, they have 10-step skincare regimen. So essences would be one step. Okay. But
Okay.
me, I usually go straight to serums. Serums are actually my personal favorite because they are highly concentrated, meaning they contain a high amount or a high number of skincare actives.
Yeah.
So they can be very useful for targeting very specific skincare concerns.
I see.
And actually, we both have 2 serums.
Actually, that's true. Yeah.
So we both use hyaluronic acid serum. Now, hyaluronic acid is good for hydrating the skin. So it can absorb 1,000 times its weight in water, very scientific. And actually, what I love about this product is that it's the key to dewy glass skin. Okay. So yeah, we can, start to apply our hyaluronic acid serum.
Okay. So while we're getting into this serum application, do we put it directly on the face or do we put it in our hands and dab it?
Honestly, when I'm doing contents, maganda kasi if, di ba?
Yeah. Up close.
Yeah, but in real life, you just put it onto your palms and then...
Okay.
Yeah, same thing, like maybe 3 drops would do.
Is there like a science to that as well?
Not really. Honestly, if you apply it directly onto your face, it wouldn't change a thing.
Okay.
Like, I mean, it doesn't make it less effective. There's no really like a standard way of applying skincare. What works for you? But then, you always tell the patient to avoid, like putting the dropper too close to your face because it might lead to, bacterial contamination. Yeah. So,
Interesting. So when sometimes I don't know how to apply like on my forehead. So it's still upwards motion.
yeah.
Okay.
Most of the time, because we're trying to defy gravity, so it's like sweeping upward motion. Yeah, and then if you have gua sha or if you use gua sha,
Yeah.
you can also use it. But me, kasi I don't I'm just being real.
Yeah. But you
Yeah.
can. But you're saying
but
that
you can
use
use it with gua sha, so like...
as long as it's sanitized, I guess, or clean.
Yeah, and then it's usually with the serums.
So you use gua sha with the serums. Got it. All right. So I also want to ask in terms of serums then, what's the order of like that in between, no? Of like there's essences, serums, like maybe face mask or something. Is there a particular rule that you have to follow so that so that we remember like the order of like we don't mess up an order, or is it strict with an order?
Yeah, in general, it should be from thinnest to thickest consistency.
Thinnest to thickest, okay.
Yeah, and the hard thing nowadays is that I'll demonstrate it later. But this is a serum. It's like watery. But this one is also serum. But then you can see, well, I can demonstrate it now. That you can see it's more
It's creamier.
cream-like,
Yeah.
right? So, well, in my case, it's easier to pinpoint that the hyaluronic acid serum should be first than the retinol serum.
Okay.
Unlike, well, with your case, they're basically...
They're about the same weight.
Yeah. So, in general, if you have like the same type of serum and you can't really determine which one is of thinner consistency, one thing that I tell my patient is that you always have to use hyaluronic acid serum first. And then you can pair it with another serum or whatever, like a moisturizer or an ampule. Like, it's usually hyaluronic acid serum first.
Is there like a scientific reason behind why it should be first?
Yeah, so basically your hyaluronic acid works best when it's applied directly onto damp skin. So it can, attract the water and hydrate your skin. And basically when your skin is well hydrated, it makes it absorb other actives better.
Oh, I see.
So
Okay.
you can like somehow boost the efficacy as well as benefits of the succeeding skincare actives.
Okay. And so now you're about to apply your retinol serum. I have a, it's waiting.
Yeah, it's here.
Yeah, and then also, so for me, I'm applying glycolic acid. So could you also tell the monsters what glycolic acid does for your skin?
Yeah, so glycolic acid is actually also one of my favorites. It's actually G for glow. So it gives you that glowing skin.
Okay.
So it works as a chemical exfoliant to exfoliate, to exfoliate dead skin cells so that you will like be more radiant the following day.
I see. Okay.
And actually in the United States, they have skin cycling. I'm not sure if you've heard of it.
Sounds familiar. But
Yeah, so what they
is it?
do is day one, they'll be using a chemical exfoliant like glycolic acid. Day 2, they'll be using retinol. Day 3 and 4, just, moisturizing. And then they repeat it all over again. So this skin cycling is specifically for those who are beginners so that you get like the most out of the skincare actives without really like risking any irritation or side effects.
Okay, so is glycolic acid like one of the more, what do you call this, potent kind of acids that you, because like for me, when I first heard of glycolic acid, I was like, I don't know. That's kind of, that sounds a little serious of a skincare product.
Yeah, well actually, glycolic acid is safe for all skin types, especially if it's less than 10%.
Okay.
That one is 9.8.
9.8,
right?
yeah.
Yeah, so it's still safe. But basically, of course, when you exfoliate your skin, you do expect micropeeling. Because sometimes patients will tend to panic now, oh no, I'm like peeling. So, it's part of the, how do I say this? It's part of the benefits or the indications that the product is actually working.
Oh, okay. So it's not necessarily a bad thing, at least in terms of glycolic acid, that there's micropeeling.
No. Well, in terms of retinol as well, sometimes you get peeling, but then as long as you use a good moisturizer, it's okay. As long as there's no redness, burning, or stinging sensation, it's okay.
Okay, all right. Okay, so now we will apply our second serum. So I will apply my glycolic acid and Doc Bea will apply her retinol.
Oh, by the way, yeah, so like what I've mentioned a while ago, I wouldn't really combine glycolic acid with retinol.
Oh, yeah, that's a good one.
Yeah, so hyaluronic acid is safe to combine with all the other skincare actives, but I wouldn't really say like you can mix and match glycolic acid with retinol. So you have to also be careful about those stuff. There are actually a lot of rules. And when in doubt or you're uncertain, you can always consult with a board-certified dermatologist.
Like Doc Bea. Yeah, and so, and glycolic acid, by the way, it also helps minimize pores, is that right?
Well, for
Or
me,
minimizes the appearance of it?
yeah, well, one of its benefits, but it's more for glowing skin. And well, it can lighten dark marks, I would say.
Ah, all right.
Yeah, it
Cool.
can lighten dark marks. So I wouldn't really say that it's the first choice in my head if I want to like minimize pore appearance. I would use retinol instead.
Oh, okay.
Sabay plug.
I
No, just joking ah.
know. Okay,
Yeah,
okay. So retinols.
Yeah, so retinol naman, it's a vitamin A derivative. So what I love about retinol or retinoids in general is that they actually stimulate collagen production.
Oh, okay.
So they can minimize appearance of fine lines and wrinkles, and then of course they also get rid of uneven skin texture. Well, glycolic acid can get rid of uneven skin texture as well. But to minimize pore appearance, I would go for retinol more than glycolic acid.
Ah, I see. Okay.
Okay. So yeah, I'll be applying this. So with your retinol, for beginners, you have to start it slow, maybe 3 times a week, and then it's usually pea size. So this one, I usually use half a pump. I don't know if it helps.
Yeah,
but
yeah,
it's
yeah. I
just
think
half
so.
a pump. Yeah, like not the full pump. And then what I do is I distribute this equally 5 areas. So it will be my forehead, my nose, my chin, my cheek. And then I'll spread it thinly.
Oh.
Yeah, and then sometimes you might feel na parang, Doktora, will it work ba? Kasi it's like very thin.
Very thin,
na.
yeah.
Oo.
Yeah.
But you know, some even gets irritated just like by a few amount.
Wow.
Yeah, so, well, it usually depends on the condition of your skin when you start your retinol. And of course, you might also have purging. Yun pala. Even glycolic acid can cause purging. So, you know, if you do get like a few acne here and there, don't panic, it's normal. So basically, purging is a phenomenon wherein your skin tries to declutter itself and tries to get rid of all the formed acne on your face.
Oh, so that's what it's called. And so that's why also, I think that's why some monsters or whoever it is who uses like new skincare products, as soon as they see their skin break out, they would think na parang it's not like it has a, what do you call that? You're experiencing side effects.
Yeah, and then, you know, it's really hard to distinguish if the product, if like it's a normal side effect of the product, if it's really just purging, or you're not reacting well to the product. So if yun nga, you're uncertain, you can always consult with the derma because there's no hard and fast rule eh. But then me, when I see patients, I don't know, I just get the feeling na parang, oh, you're using this, no? And then you have to stop it. Parang it's a gut feel.
It's a gut feel na. It's a derma.
Yeah, it's a gut feel.
Gotcha. It's funny that when you were actually applying the retinol, I was kind of shocked because I always thought retinol was just for like the under eye.
Oh.
Yeah.
Well, yeah. Well, there are retinol eye creams that are specifically made for under eyes. Like this type of serum, I wouldn't really recommend it for thin skin areas like the eyelids, the nasolabial folds, and the periorbital area. So, but, you know, eye creams in general are specifically formulated for thin skin areas. So the risk of you getting irritated or having side effects would be less. Even for vitamin C, it's applicable. So, yeah, if you plan on using retinol or vitamin C for your under eyes, it would be best to just purchase like eye creams for it.
Okay, gotcha. So retinol can actually be for the rest of the face, not just for eyes. And there are eye-specific ones. I mean, under-eye specific ones for retinol. Now, Doc Bea, when it comes to trying new products, no, we talked about this a little bit. Yes, we should probably consult if we feel like we're experiencing side effects. But then, if there's no side effects naman, but you feel like there's no change, how long should we wait for a product to actually be in effect? Or how long does the skin usually adapt to a new skincare product?
It's usually 8 to 12 weeks.
That's a long time.
Yeah.
A lot of us are very impatient.
Yeah, I do get a lot of patients that will send me a message after 2 weeks and will be like, Doctora, what's happening? Is this normal? Like, I'll be like, chill ka lang. It usually takes 8 to 12 weeks. So that's 2 to 3 months. Sorry guys, talagang no shortcut whatsoever.
Gosh. And so like every time, so that goes for any new skincare product that we apply on our face?
Yeah, well, actually, hyaluronic acid serum works immediately.
Okay.
Like, it gives you that instant plump and dewy glass skin. Yeah. But for the rest, yeah, you need at least 8 to 12 weeks.
I see. Okay. Now, so we've done the retinol, we've done our serums. What's next for you? Because I know I'm not part of this step now.
Yeah, so I'll make you boodle again.
Go for it. I'm
so
ready.
This one is actually an ampule set.
Ampule. Okay. Essences, serums, ampules. What is ampules naman?
Yeah.
That looks so pretty.
So, wait lang. So, this one, I got this. And when I got it, parang, grabe, I got so kilig. Diba?
It looks really, it looks more like aromatherapy than what you put in your face. But it looks really nice.
Well, so basically, ampules are a more concentrated version of your serum.
Oh, wow. Okay.
So, they're really more expensive, I would say, and you usually just use them maybe 2 to 3 times a week on days that you really need that extra boost, or when you're having skin crisis and you need like faster results. Okay. So, this one naman, wala. Dinala ko talaga the whole, diba?
Yeah, I know.
Yeah, because I feel like, if you're a guy and you're watching this is a perfect gift for, like, your mom, your sister, or your girlfriend. I don't know. It's like infinity stones. I call this the...
That's actually true. It's so pretty to look at.
Yeah, I call it the infinity stones of skincare. May ganon. No, but basically, honestly, I seldom get to use it. I just display this on my dresser because it's so pretty. So this one actually contains Centella asiatica. So it's supposed to be anti-inflammatory and calm and soothe all the drying or all the dryness and irritation of your skin. This one, it contains pink Himalayan salt, so it's pore minimizing. And then this one, it contains niacinamide for brightening and evening out the skin tone. And then lastly, this one, it contains tea tree oil, which has antibacterial properties. For these 4, I've only tried this one when I had like severe breakouts last February.
Oh,
Yeah,
okay.
so I think it did work for me because like...
Well, it's gone now.
Yeah,
so
I think it worked. But
Okay.
yeah, I just want to show you this.
Okay.
It's like a plaque. I don't know.
Okay.
I love the the products.
Yeah. So will you be applying one tonight, or do you apply ampules the same way you would serums? Like still
Yeah.
on the palm and then rub and then dab?
Yeah, so
Okay.
basically it's the same principle. And no, I usually use this on certain days lang.
Oh,
on certain
okay.
occasions.
And then, because, so we have our serums and our essences and our ampules as well. Is there like do we have to wait X number of minutes before we actually apply the next, whatever next skincare product there is, whether it be toner or a serum or a face mask?
Yeah, well, it's only applicable for retinoids because retinoids are more irritating when you apply it directly onto damp skin. So
Okay.
only retinoids. I wouldn't really say that you have to like space the intervals between serums and moisturizers because serums should be directly absorbed onto your skin because they're very lightweight, fast absorbing. Di ba parang like when you apply it, wala na.
Yeah. Pretty much,
Yeah.
it's gone now.
Yeah, so I wouldn't really say that you have to space them out. Except for retinoids.
Except for retinoids, okay. And so now for our maybe younger viewers and listeners, what are some skin conditions, or rather, okay, skin conditions, yes, but also active ingredients that they should look for in terms of like skincare products, so that they know, so that they can make the products work for them?
Oh, in general, when you're younger, like less than 20 years old, if you don't have acne, like you can stick to the 3 basics, like just a cleanser for your skin type, okay? And then of course a moisturizer and sunscreen. That's it. Because you don't really need a lot of stuff. But
When you're younger.
when you're younger. But then when you reach 20, ako 20 eh. Because some studies would say 25.
Yeah.
Me, 20. I don't know. Me lang. So when my patient reaches 20 years old, I give them retinol na.
Really?
Yeah.
Wow.
Oo. So you try to prevent aging as early as possible talaga.
So it doesn't negatively impact your skin if you use retinoids early on?
Not really, but it wouldn't really like give you visible benefits, or like it wouldn't really do much for skin. Because we also want naman to apply, we also want to be cost effective or cost efficient, meaning you want to purchase products that would work for your skin and not like, just apply it for the sake of, I have skincare.
Yeah. I see. Okay, so the retinoid would be to like when you mentioned, it is preventive skincare, so that maybe when you're already in your late 20s or 30s, you probably not see any prevalence of premature skin aging because you've been using retinoids. But again, you should consult with a board certified dermatologist to make sure that it's the right retinoid, and if you're at the right age, or which product exactly that you should use for retinoids. Now, what is your next step? I mean, like, we have another question, but what is your next step, naman?
Our next step is, of course, the eye creams.
Eye cream. All right,
yeah.
I'm joining now.
So mine, again, it's an eye serum. So, it contains vitamin C. But this one, it contains pure form of vitamin C. So, it's L-ascorbic acid. Now, the thing with your L-ascorbic acid is that it's really unstable in the presence of light and air. So, it's usually placed in amber bottles. But then again, it still like oxidizes quickly. So I'm not sure if it's because of the room temp, because it's hot here in Manila. So maybe if you have skincare fridges.
Yeah, I was gonna ask about that. Like, is it necessary to have a skincare fridge?
Yeah, I think for this case, it would be applicable.
Okay.
To lessen the oxidation. Because mine, don't judge, but it's kind of burnt orange in color.
Okay.
So I'm sure it has oxidized. So now you might ask, Doctora, what will happen if you use like oxidized vitamin C? Not much, but it will be less effective than its usual
If
regular.
it oxidizes.
Yeah.
Wow, okay.
So basically, I've been using this, and then it's sayang kasi also eh.
Ganun talaga with skincare product. Investment kasi.
And then you mentioned a while ago, so with eye creams, I use my ring finger.
Right, okay. So mine is a collagen anti-wrinkle eye cream. Preventive skincare.
So like yan, diba? So even for eye creams or eye serums, different consistency.
Yeah.
So it's really hard to give like a hard rule on, like, you should use this first and then that. It would really depend on the formulation of the product.
I see.
Sometimes
I love that we're just dabbing while we're talking. It's okay.
Yeah, but I don't know. But for most of my patients, I usually ask for the brand as well. And if I'm not familiar with the brand or I haven't used it before, I usually check it talaga sa net para I can like give personalized recommendations and advice to my patient.
Does it just apply in the under eye, or do you go around the eyes also?
Oh, well, you can apply it on the upper eyelid as well. So basically, just this area. The thing with your eye serum or eye creams, they are a bit more expensive.
Yeah, that's true.
Yeah.
And they come in really tiny little jars.
Diba? So parang me, don't use it in any other areas. Just, the periorbital areas, I would say. Like here, the crow's feet.
Yeah.
Of course, it would also help. But me kasi, I'm using vitamin C. So primarily, it targets dark circles. Diba?
I know.
I told you a while
Yes,
ago.
Budol. Okay.
Yeah, and then it also contains tripeptide, which are building blocks for collagen production and hyaluronic acid. In your case, of course, it contains collagen, so it's a good hydrator, so it can hydrate the under eye area. Aside from that, it also helps stimulate collagen production.
I want to ask pala, how do eye bags form, and what is inside these eye bags as well?
Yeah, so what you have to understand is that eye bags, in a sense, are also genetic or hereditary.
Okay.
And dark eye bags are common for Southeast Asian races.
Oh, fun.
It's because of our skin color. Yeah, so I don't know if you've noticed, but diba, like even in K-dramas, you don't see naman diba, that they get like dark under eyes talaga. So it's more of the race, genetics. So that one, you can use vitamin C. For me, vitamin C would be the best. However, there would also be a vascular component. So vascular meaning the blood vessels here.
Yeah.
So you can also use caffeine. Ito, I posted a TikTok video. I think it was 2 weeks ago lang. So, I just put like caffeine. And then, some would misunderstand that, Doctora, when you drink coffee, no, it's not like that. So, it has to be topical caffeine.
Okay, so they sell those? That's available?
Yes.
Okay.
I can't mention the brand.
Yeah.
I'll just tell it to you. So it's a brand from Thailand.
Okay.
It has caffeine. And then what it does, it like constricts the blood vessels. So it gets rid of the reddish or bluish tint. And sometimes it also gets rid of the puffiness.
Okay.
So the principle is that, of course, when your vessels are dilated, the fluid will like go out into the extravascular. I'm getting
very scientific.
Yeah.
All right.
So
Okay.
it's like that. And then when you constrict it, so the puffiness will also lessen.
Okay. So, caffeine infused eye cream.
Yes.
Okay, gotcha. And then for those who are interested, who have eye bags or dark circles, is that also applicable?
For caffeine, yeah.
For caffeine, okay.
I'm not sure if it's
No, I don't see
it-
anything anymore.
okay.
You're good. Okay.
Okay.
We have done well with our eye cream. Okay, so we're nearing the end of our skincare routine. What's next for you?
Yeah, so
I only have the one left, but okay, go ahead.
yeah, so these are some of the moisturizers that I've been currently using. So like what I told you a while ago, it's when I reach my 30s that I realized that moisturizers are really an essential part of your skincare, whether you have oily or dry skin. Please, use moisturizers. It's just, finding the right type of moisturizer
Yeah.
and using it at the right time.
The right time.
Yeah, so kasi we have this misconception that you have to apply moisturizers in the morning, but when it's summer, and then of course you're in Manila,
Yeah.
it's not really that applicable. So what I do is that I invest on a good cream-based moisturizer at night that can provide me long-lasting hydration, 24 hours, 48 hours, all throughout the day.
Oh, okay.
Okay, so here are some of the moisturizers. So this one is the most expensive. Actually, it looks really thick,
Yeah.
but then it's very lightweight. Actually, the first time I used this, I was really surprised because I would think that it would just sit on top of my face, but it got absorbed quickly. So I'll demo. Wow,
Okay,
I'll
there
demo.
we go,
Yeah.
there we go.
So this one, it contains hyaluronic acid and ginseng, which is of course a popular antioxidant and anti-aging ingredient. So basically, it's very lightweight, non-sticky at all. I'm not sure if there's remaining moisturizers.
There's a little bit pa. Go pa. Pahid pa.
Okay, so yeah, so basically, just massage it onto your face.
Okay.
And
And it's
then-
always outward motion.
Yeah,
Okay.
outward and upward. Okay. So, I'm feeling...
Is it very relaxing that you're slowing down?
Yeah, I'm getting sleepy. Ito talaga yung nighttime routine ko. So, I guess it's my brain sending signals.
Yeah.
Na, hey, it's time
It's
to
time to
sleep.
sleep. I get
Yeah,
that.
so basically yon. This one, it's very lightweight. I'm not sure if it's...
Yeah, it's good. Yeah.
Okay. So, the other moisturizers, this one, it contains retinol plus bakuchiol. And actually, I really like to use it on days where I have like severe breakouts. I think it's because of the bakuchiol part. Here's the thing pala. No, kasi I think it's also a common misconception for us to overcompensate. Like for example, you're
Yeah.
breaking out. Well, baka ikaw hindi eh. But for most patients, if they break out, they try to use all harsh actives.
Yeah, that's true.
Yeah,
And they'll layer it on one after the
so
other.
parang salicylic acid, everything.
Yeah.
And then it will lead to damage of their skin barrier, and it will actually lead to more breakouts.
I see.
So
yeah.
what I do is actually I use this, and then what I found out is that it calms the redness, the inflammation.
Okay.
I know it's marketed for anti-aging purposes, but I also use it for my breakouts to calm down, because the bakuchiol actually can calm and has soothing effects for inflammation.
I see. Okay.
And then, sorry, ang rami, no? And
No,
then,
it's good. At least we know different kinds of moisturizers that we can actually use.
yeah, and then this one, syempre, I brought the box pa, no? No, this one naman, it's vitamin C moisturizer. This is the heaviest, actually. Of course, I wouldn't use this in combination with the retinol. It's really, really very heavy. This one naman,
So no retinol with this one.
yeah, because
Okay.
it contains vitamin C. This one naman, I always use this during my PMS days
Okay.
when I don't look and feel my best. Yeah, but then
Relate,
this,
yeah.
diba? But then this one will sit on top of your face lang.
Oh, like a mask-ish?
I can't explain it. You wanna try?
Do I want? Can I use it? Because I put hyaluronic glycolic,
Yeah,
so
it's
I'm
okay.
safe.
But
Okay.
yeah, para lang you'll get what I mean. It will
Okay.
sit on top of your face.
I just need a small piece of it. I don't need to put like.
Yeah.
Okay. Here we go. Where should I put it? I'm not
cheeks.
sure. To cheek. To cheek. Okay. I will
Yeah,
put it in
so
the cheek.
it will just sit on top of your face, and then you might like worry about it.
Mm-hmm.
But next day when you wash it off, you'll be like a new person, like instant
see.
glow.
Okay. So, like, do I make it diin? So for products that seem thick and will sit on your skin lang, how, like, when will we know when to stop, like, rubbing that area?
No, kasi basically you'll know na it just like sits.
Oh,
on
it
top.
doesn't want to like be
Yeah,
absorbed.
you'll
Okay,
get
I
it
feel
na-
it now.
Diba?
I think it makes sense.
Like it, parang when you apply moisturizer, para siyang all caps na moisturizer. Like, if it can talk, it's like moisturizer on top of your face.
Okay.
I hope they get me. Medyo weird yung humor ko. Pero, like, ganon. Diba? Like, it sits on top.
Yeah.
And you might feel na parang, oh no, is this good? Does this clog my pores? But then, when we sleep, we usually are in air-conditioned rooms. So, it basically won't stimulate excess oil or sweat production, and it won't clog your pores. And swear, next day, you will be a different person. Like, you have that, woke up like this look.
Oh,
Yeah, kasi
really? Okay.
Vitamin C talaga for brighten.
But once you rinse off, or you
Yeah, you have to rinse it
cleanse?
off kasi when you wake up, it's kind of a bit oily.
Yeah.
yeah, so
So it's a fake woke up like this. I had to cleanse first.
Actually.
Okay, got
yeah.
it. All right.
So, yeah, hopefully they're enjoying. I'm enjoying.
I know, no, I love that we're actually demonstrating also how skincare works, how we can apply it, what we can apply on our skin as well. I want to know, since we're nearing the end also of the show, what other products do we have, like just like not necessarily essentials, but we can add into our skincare routine?
Yeah, so again, this naman, it has been my secret. Wow, secret ko talaga. No, for a long time, I've been using face masks pre-events. So
okay.
if it's your wedding day or you have a special party, it's really important to have your skin well hydrated. And if you want immediate results, face masks are the way to go. However, don't naman try new products or brands or
right.
varieties of face masks the day before an important event. Because, some would contain fragrance or some actives wouldn't really work well for your skin. And you might get an allergic reaction or possibly, breakouts.
Yeah.
So basically, what I would suggest is maybe leave the trial and error on a regular day and then just go for like a trusted brand or something that you have been using for years now for special events.
I see. Okay. And so face masks and also, the pimple patch. Yeah, educate us on that. I learned a lot off air. So
Yeah, so do you guys use pimple patch?
yeah. No, I do. But like what I told you off air, it's like, well, now I realize that I was applying it wrong or on the wrong step during the skincare routine, because I would assume that after toning I put the patch because I feel like the other products would irritate the skin. So, Doc Bea, please educate us. What's correct?
So basically, for your pimple patches, the main goal is to prevent you from, touching it, scratching it, or popping it.
Yeah.
So you won't see it, okay? And then it also serves as a hydrocolloid patch. Scientific ulit. No, basically what it does, it draws away the pus or the excess fluid. So what I've been telling Nikki is that, you only use it when you have that pus. When you can see that, white dot, it's the optimum time to use it.
Okay.
And then, basically you have to apply it at the end of your skincare routine, because you also have to apply your acne medications. Don't forget, diba? Because if you apply it immediately after toning, you don't get to apply your acne medications. And then sometimes, like what I told you guys, there are moisturizers or serums that contains anti-inflammatory ingredients that would also help with the healing and recovery of your pimples.
I see. Okay, got you. So pimple patches at the end of your skincare routine. Now we have two big tubes at the end of the table, and this is for the rest of your body naman. It's not just your face, you guys, for skincare routine.
Yeah.
And a lot of us will stop at the face. I know, I do it too. So tell us in terms of not necessarily application, but what are do we have to look for some ingredients for?
Yes.
Okay, go ahead.
So again, same thing with the skincare for your face. Actually, most actives are the same for the face and the body. So for example, like our favorite, talagang dineclare, no? Our favorite would be the hyaluronic acid.
Right.
So like this lotion also contains hyaluronic acid.
Oh, nice.
So same purpose, to hydrate your skin, keeps you glowing. And then there are also certain products that are more for dark spots, like it contains vitamin C and arbutin. So it will primarily depend on your body's concern. It's okay naman to experiment or to try new products, but then some of you guys who have sensitive skin don't really tolerate those with fragrances. There's some lotions with a lot of fragrances Na
Yeah.
even me, when I smell it, I'm not sensitive skin, pero like, I also panic in my head.
Yeah.
Na, oh no. And of course, I usually don't recommend lotions with fragrances for my patients. Because it's hard. Diba, syempre, when you're a doctor, you want the best for your patient and you want na there won't be any like side effect or irritation.
Yeah.
So yeah. But then, if you're that type naman na like uses a body, diba uso that also? Like for a brand, you have like body wash.
Yeah.
And then you have a body lotion with the same scent.
Yeah, that's true. Yeah.
There are some. But me, personally, I don't go for those products.
Okay, gotcha. So it depends really on what you guys are looking for. If you guys want a soft glow, more plump skin, hyaluronic acid, which you also apply on your face. And then we also have like other specific ingredients, depending on what result you want from your skin. Tama ba?
Yes.
Okay.
And then, last step.
Okay. May last pa. Okay, go.
Last. So, this one, it's a lip sleeping mask. So, I love this. Even before it's available here, I always make pasabay in Korea. So, naturally, I'm dehydrated. So, if you're one of those na, like, laging dry and chapped yung lips,
Yeah.
I would suggest that you go for this. Because this one also contains hyaluronic acid.
Okay.
So yeah, it makes your lips plump. But I wouldn't really recommend to apply it like on daytime. Because it's kind of sticky.
Okay. So when you're about to go to sleep.
Yeah.
Okay, got you. All right, that's awesome. So basically, we're done with our skincare routine. I just have half of my face with like a thick cream, which will look glowing tomorrow, apparently. But also, I want to know because while we were talking, doing the whole skincare routine, a lot of monsters are probably wondering. This is just like a girl's night kind of thing. It's always like skincare routine, and then it would just apply to women. But tell us the importance, Doc Bea, of skincare for men.
Yeah, so actually, like what I've been telling you, my husband is one of those na super stubborn talaga. I think he's listening.
Shout out.
Yeah, so well, yun nga. So I tell him, you might get like your pores. I can see your pores. Your skin is oily, etc., etc. And then, weirdly, like recently, a month ago, my dad, he kept on complaining about, some solar lentigo. So those basically are age spots on your face brought about by cumulative sun exposure. And that's what I've been telling him, or maybe that's what I want to emphasize to the viewers, that, you don't want to start skincare when you already have those problems.
Yeah.
Because my dad naman, he's trying to overcompensate. Like, keeps
Oh,
on
no.
asking me for sunscreen. Like, can you give me more? Like, grabe talaga the skincare. And then he also uses this, the retinol and bakuchiol. So, yeah. And then, I would say that prevention is still better than cure.
Right. All right. So for the male listeners and viewers of the show, try out a skincare routine that works for you with your skin type as well, because before it's too late, before you start to see the effects also of how poorly many of us have actually been taking care of our skin from our 20s or even in our teen years, I guess, or in our college years. So it would be super helpful if you guys, you don't necessarily have to look like a Korean actor or a K-pop star, but at least you're doing your due diligence and also investing in your skin. So that's pretty much our show. Like we actually did a whole skincare routine during the show. So thank you so much, Doc Bea, for joining me this evening. How can our monsters find you if they want to consult with you, if they want to have services done, I guess, or just have you recommend certain either products or maybe procedures for them depending on their conditions?
Yeah, so basically you guys can send me a message on Instagram at BeaMaxineMD, and then you can also follow me for informational content about skincare and derma-related stuff on TikTok at BeaMaxineMD as well.
There we go. So with all of the information that we have absorbed this evening, like our skin, I hope that all of you monsters will know now, I guess, in terms of like how to improve your skincare, that you should have a skincare routine, and that we should take better care of ourselves before we start to see the after effects, or like premature skin aging, especially for people of a certain age. So with nothing else, thank you once again to all the monsters listening and watching on YouTube, Facebook, on Twitch, and also on TikTok. Super appreciate it. Next week we'll have another guest, but for now, keep it locked only here on The Monster. Bye-bye.
Monster exclusive interview. Monster exclusive interview. Only from Manila's hottest. Monster RX93.1.